To get a sense of just how badly the global economy and the Indian economy will be impacted by the coronavirus and what's the best way to be able to deal with the economic challenges, I want to go across now, live and exclusive to one of the world's leading business schools. Joining us at this moment is the former governor of the Reserve Bank of India. He's teaching finance at the Chicago Booth School. Welcome, Dr. Raghuram Rajan, to India today. You know, we are currently in an unprecedented situation in a very literal sense. Can you, on the basis of everything that you've seen in the public domain so far, give us your best sense of the net impact the coronavirus is likely to have on the global economy?
Well, we have some data which we have to extrapolate. We know that the Chinese economy went down by about 10% of GDP in their first quarter. And the estimates for how much the European and the US economy will go down are of similar magnitudes, double-digit drops in GDP in the second quarter. That is assuming that you can contain the virus by the end and then you can start relaxing measures. At this point, everybody is looking at China to see if the relaxation of measures there is going to start an increase in cases once again. And if, in fact, you do have recurrences, then the damage could be more lasting because the measures have to be in place for longer. So this is the big unknown. How long will it take to get it under control? How much GDP will be lost in the process? And how much can be recovered when the measures are taken off? So
how about extending those estimates to the Indian context, because we don't know what the full extent of the coronavirus will be in India? Is it possible to get some sense of how badly hurt the economy will be? Because what we do know is that there is a complete shock to the economy at this moment. Mass factories being shut down, very few people being employed, lots of layoffs, people trying to go back to their villages. How will this translate into numbers, Dr. Rajan?
Well, I think at this point, nobody knows. The key, however, is to make sure that a temporary shock doesn't become a more permanent shock. In other words, that we don't see a downturn, slow cash flows, slow revenues, no incomes for workers, and that leads to substantial layoffs, that leads to firms closing down. And when we do get the coronavirus under control, there's much less economic activity because those businesses don't start again. So we need bridges between now and then. For the most vulnerable households in India, of course, for the poor, for the migrants, we need ways to get money to them. So over this period of shutdown, they can keep body and soul together. But we also need to keep firms, the small and medium firms which have suffered shock after shock, we need to keep them from closing down if they're viable. And that decision is a careful one because we can't keep every firm alive given that we have limited resources, but we should keep the viable ones alive so that they can reopen. And similarly for the large firms. So this is a really careful process that has to be gone through over the next few months.
There's a big debate raging in India and globally about whether this is the right opportunity to extend some kind of a universal basic income. In the Indian context, government revenue is already deeply overstretched and you need extra revenues to be able to take care of healthcare facilities. However, you have to also deal with all these people who don't have any money coming into their banks and their pockets. Do you believe that the government in India should seriously be considering some form of income support at this time, Dr. Rajan?
Temporary income support as targeted as possible makes sense. But beyond that, we don't have the money. I think at this point, as you said, we need to prioritize. First off, we need to spend the money on medical facilities, on ventilators, on masks, on getting protective equipment for our brave doctors and nurses so that they can do the job. And that means bringing every resource in, whether it's private, public, defense, retired, get everybody in on the act and quickly create quarantine spaces. We simply need to keep those who are infected separate from each other. All this will require fiscal resources, and this is the highest priority. After this comes getting money to the households that are affected, whether in rural areas or urban areas. We do have means of getting it across to the rural areas much better. Urban areas, identifying the poorer households and getting money to them is going to be more difficult, but we need to do it. And then Only after that do we need to think about other measures, but no long-term measures at this point. Let's fix the problem first and then move ahead. Measures to cut taxes in the long term or to universal basic income in the long term. This is not the time to discuss that.
Oh, you're saying this is not the time to be discussing universal basic income. Leave that for a later date, because there have been many calls. We've seen in the United States, the government announce some kind of relief measures. What Justin Trudeau did in Canada came in for much appreciation. You're taking a completely contrarian position. You're saying deal with the crisis first. This is not the time to try and roll out something big and ambitious.
Not really. What I'm saying is targeted income transfers for a couple of months till we get over this. Hopefully, it's only a couple of months rather than many quarters. I think that makes sense. Relief to affected households, relief to the poor households, that makes sense. But universal basic income means paying these households forever. We don't have the resources or the time for doing that right now. Let's not talk about it. Let's talk about relief measures. That's what we need to be talking about.
One of the things we've also seen after the coronavirus breakout is global supply chains being upended much more than earlier. What are the lessons do you believe Indian manufacturing, Indian government and the Indian economy need to draw? Because at this time, there are several critical resources we need to import from companies like China and some in Europe, and suddenly they're saying this is no longer available to India. What are the lessons we need to draw, and what can we do in the immediate context, Dr. Rajan?
In the immediate context, we have to just find wherever we can the necessary supplies, and to the extent they are elsewhere, we have to cajole, push, and this is a central government activity because state governments cannot do that. So we need the supplies wherever we can find it, and we can be assured that every country is trying to do this at this point. So we need to work as hard as we can and bring whatever pressures we can to bear on that. But beyond that, of course, it raises the question, do we have self-sufficiency in critical resources? And there is a value to thinking about that. But that's a medium-term issue. Do we have all the medical supplies we need, et cetera, et cetera? That's a medium-term issue. Short-term, we need to beat around the bush everywhere in the world to see where there are spares. China may have some, given that it's actually controlled the virus, and maybe that's where we look right now.
What can central banks do in this context? There's one big demand that central banks should reduce interest rates and do that without waiting for the next monetary policy to come out. The other is, even if they did, given how risk capacity and investment capacity is completely gone for a knock, no matter what central banks do, it won't make any difference. What's your view, sir? How should the Reserve Bank of India be trying to intervene given all the dynamic at play?
Well, I don't want to give advice to the Reserve Bank. They know what to do. Let me just say this, that again and again, we're coming up against the fact that we have a financial system which is impaired. And of course, I've been saying for quite some time, we need to clean it up so it can function as necessary. And we see the problems right now when it, as you said, may not be able to offer the credit support that is needed to businesses. Well, unfortunately, given that it's not providing that support, we have to try and do what we can from the government side to offer partial guarantees to make sure that banks continue lending to small and medium enterprises and to large businesses. But again, here we have to be careful that we have limited fiscal space. So there has to be some incentive for the banks also to take credit risk into account. We can't just write them a blank check. This has to be done very carefully, very cleverly. And obviously, as you say, it is harder when the banking system is impaired. But at this point, I would say take a cue from the central banks across the world, which are contributing to solving the problem by easing liquidity. Liquidity should not be a constraint, but also helping in credit. That is something we have to think about carefully since we already have large NPAs, but certainly some help is warranted.
You know, Yuval Noah Harari, one of the world's leading historians, said the COVID-19 will ensure that the world as we know it changes forever. We spoke to Ruchir Sharma. He said that this could lead to a depression as serious as the depression of the 1930s. Do you believe that the world as we know it is going to change forever? In what way, Dr. Rajan, do you believe that COVID-19 will change everything that we know once this danger subsides?
Well, I want to say it's a little early to try and predict which directions it will change. Of course, it's a huge, unprecedented event. Think about what you just said. It could lead to countries being much more wary about having supply chains across borders because they know they can't rely on them in bad times. That could be one outcome. But the other outcome is it could bring the world together, knowing that we have to deal with such huge global challenges may make us more aware of the need to deal with climate change. So it could move in any which way. We have to see how it works out. But of course, what matters is how long it lasts. And that's where the difference between a recession, which is almost surely on the cards now, versus a depression. If it lasts for a long time, we have significant subsequent waves after first suppressing it, then we may be heading for something deeper and more longer lasting. But if we can control this within a few months, then perhaps we have a recession and perhaps a rebound over time after that, and then it's not so bad. But certainly we'll learn the lessons from it and we'll do things differently in the future.
Are there any policy interventions you'd like to see from the government in India? One, of course, you spoke about, ensuring that there's some kind of income support that comes in, but outside of that, what can government do in a policy framework context to ensure that they try and alleviate the pain that people will have to feel and try and use the capacities that corporate India has to make the most of what is available?
Well, absolutely. I think it is bringing all the resources together and directing them at the places that need them the most. So we need to find out where are the masks, where are the ventilators, where is the spare hospital capacity, where are the unnecessary operations being performed to shut them down and make hospitals available for coronavirus victims. These are all things that certainly the central government can organize. But I also think there are two very important things the government needs to do. One is communicate very clearly that this is a national emergency. Just because you don't have it today doesn't mean you won't have it tomorrow. And that even for young people, they are responsible for spreading it, even if they're not terribly badly affected. And so get everybody to start paying attention to hygiene, to washing, to isolation. That is something that the government, especially with our Prime Minister, who's a great communicator, has the ability to do. That has to go on in a big way. And these parties with, many people coming together, which till a week ago seemed to be really prevalent. Those have to stop. So that's one. Get serious about the problem. Second, accumulate knowledge about where the resources are. But most important, get the data out on where the infections are, where the deaths are, so that interventions can actually happen. So we need mass-scale testing, of course. But beyond that, we need to make sure the data are out there for everybody to see, to learn from, and so that local governments, state governments, and national government can intervene. Without data, you're trying to fight this disease blind, and that is terrible.
I'll leave it over there. At a time when there are so many variables and unknowns in the scenario that we are facing, it's always interesting to have somebody like Raghuram Rajan try and put this in context as best as is possible. But he said, till the time you don't know where the problem ends, you can't estimate the full extent to which this will damage the Indian and the global GDP. But a 10% contraction in GDP in the next quarter is what he thinks at least countries like China and Europe are looking at. I'll leave it over there. Dr. Raghuram Rajan for joining us from the Chicago Booth School of Business. Thank you very much, sir. Thank you. Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.